Joining us now is Scott Cohen, founder CEO at IST OneTray. Scott graduated from Mount St. Joseph University with a BSN and worked as a nurse before joining Synthes Spine as a sales representative. In 2006, Scott started his own medical device distributorship, Contempo Medical, a spine-focused medical device distributorship. And in 2013, he became the founder and CEO of Innovative Sterilization Technologies, the makers of OneTray. Scott, I've had a chance to get to know you and your team a lot over the last few months, but it's really a great opportunity to introduce you to our entire audience today as you participate in Beyond Clean's first ever SPX2020 virtual expo. So I want to welcome you to the event. Thanks for coming on.
Thanks, Justin. Appreciate it. And it was great having you all in the office for a few days.
Yeah, I can't wait to release the episode of Beyond the Tour. That's a little bit of a teaser for everyone. But I want to step back a little bit and talk about the company itself. We talked about how in 2013 you became the founder and CEO, but tell us more about IST, or Innovative Sterilization Technologies, and then we'll get into the OneTray.
We started in 2013. My background lended itself to looking at supply chain on both the OEM, meaning the vendor side, being a distributor and a rep in a past life, and also the hospital side. So I saw the dynamics between the two, or challenges between the two, probably is a better word. And I knew there had to be a better situation than just dumping a ton of instrumentation from a vendor 2 or 3 days before the cases would happen because of the time that it would take to process all the instrumentation. Also, the turnover time needed for the instrumentation up in the operating room, and then the cleaning and decontamination side of that down in the SPD department. So I looked at that problem and tried to come up with just really a simple solution for that. We've been working on that now for over the past 7 years.
You really are an innovator and disruptor in the industry, and we really talk a lot about that in the Beyond the Tour video. But I also want to talk about some of the other videos that we developed and the content that the audience is going to be able to view over the next 60 minutes during your focus hour of SPX 2020. First off, a time-lapse video that I thought really represents the time savings very well, and also some testimonials from several of the surgeons that utilize your product. Do you want to talk about that some?
Sure. Well, we have our base product, which is OneTray, which can sterilize, any of the instrumentation needed for surgery. That's a general container that can handle anything. And then we created EasyTrax, which is another company for set customization. It's adaptable. And then we created some total joint arthroplasty sets that are very fine-tuned for total knees and total hips. And what the goal there was to really cut down the time that's needed in the sterile processing, operative environment, and decontamination side. So take care of this whole processing circle with something that's much, much more efficient. We really tried to come up with a simple solution to this complex problem. There's just too much instrumentation coming from the OEMs to deal with in SPD and in the operating room. What we did was utilize a reconfiguration utilizing our OneTray container and the EasyTrax customization system. We put that together with less containers in general. So we can take about a 7-set knee or hip set, condense that down into 3 trays, and then utilize the speed and efficiency of the OneTray side to process that instrumentation.
Yeah, that's really the innovation part. You didn't stop at the OneTray. You brought another product to enhance the effectiveness and the efficiencies that can be gained from the OneTray system by doing the EasyTrax. And the EasyTrax brochure is going to be featured during the next hour or two. So our audience that may not be familiar with that product yet will get a chance to get a lot more information and details about how it works. We've also recently released a vendor spotlight on Beyond Clean, specifically talking about the OneTray system. It was titled When Disruption Meets Innovation. And we have another vendor spotlight that's going to be released later this month on May 29th. It stars Chuck Kemp, your president of education, and it's a very timely topic discussing ways that facilities can respond to the post-COVID elective surgery wave. I think, Scott, you and I, and really many people in the industry, now that AORN and CMS has provided some guidance on resuming elective procedures, and knowing that hospitals' revenues have taken a hit over the last several months, that we're anticipating a pretty significant increase in volume. Even if it doesn't happen day one, it could ramp up pretty quickly later in the year.
Well, it's interesting. The creation of the EasyTrack system, along with the OneTray technology, we looked forward. We knew something was going to come. We knew there was going to be an outpatient push for knees and hips, which got kind of approved last year. But with this COVID situation, we think that's even going to be sped up faster. What we think is going to happen is a lot of the elective surgery patients are not going to want to go into a hospital environment where there's potential COVID patients, and they're going to want to have their knee and hip arthroplasties done in an outpatient setting rather than the hospital setting.
Finally, a lot of the education that's getting done, and Beyond Clean's been a big part of this, and now partnering with you, are webinars, because we're not able to do the in-servicing face-to-face like we have in the past. And also, I'd say workload volumes have been down for sterile processing, so it's a great opportunity to catch up on education. And our very own Bob Mars has been working with Barbara Harmer to develop a webinar that talks about the anatomy of an IFU, or instructions for use. We're really excited about this one, but I know the topic is also very critical to how you explain the science to your customers.
Correct. Everybody has to understand that the IFU is reviewed by the FDA. We can't submit a product for clearance without an IFU that's approved through the FDA. That's the book that tells the user how to utilize the product. The clearance is one thing, but the IFU is as equally important in the view of the FDA for clearance.
Scott, lots of educational content, and I want to let everybody know how they can learn more. They can visit your website, OneTray.com. They can follow OneTray on LinkedIn and Facebook. Also, email info@OneTray.com with any questions or requests for additional information. I also want to emphasize the YouTube page, because it has all the videos and surgeon testimonials that we talked about before that will be featured during this focus hour, but they're also there permanently so that people can learn more. And Scott, I know that's really important to you, because this is an opportunity to explain the science behind your product.
Well, exactly. Our product is different, and I think sometimes some of our customers or some of the people that are looking at the technology shy away from that. I urge these people to go look at the resources that we have. We have some great resources on our website, on some of the other media platforms, and we're always here to, answer questions, take questions, visit sites, do whatever we need to do. I think we're in a situation now with the COVID crisis that we're going to have to become more efficient. And we're, in my opinion, the most efficient way out there to look at vendor instrumentation and turn that over.
Scott, great job. Appreciate you helping us kick off your focus hour for SPX 2020. Thanks for coming on.
Thank you very much.
And as a reminder, you can follow OneTray on LinkedIn and Facebook. Visit their website, OneTray.com. Email info@OneTray.com for more information. And be sure to visit the YouTube page that has all the videos and surgeon testimonials that we're going to be sharing with you in the next 60 minutes.